Melissa Biscardi. I guess one of the reasons I wanted to talk to you is because of your incredible dedication to an area that I am pretty ignorant in, which is concussion rehabilitation. So I've really seen you over the years working so diligently to understand and assess and treat concussions. And I've personally, because we've shared space, I've heard some glowing testimonials from your patients. So I know that you're doing something good in the field. And what I really like about your work is not only are you a clinical practitioner working with people in real life and gaining that experience, but you are a researcher and you've recently finished a PhD, which I would love to ask you more about. And Yeah, we've overlapped in the spaces that we've worked with, so I've gotten to really watch your learning and professional journey in small glimpses since must have been 2016 when we were
Oh,
both
this
working
is
at Fusion
Weekend, right?
in
Yeah.
Toronto.
Wow. Oh my gosh, 10 years.
I know. So I have some fond memories. We were saying before we started recording that memories of you getting people to tandem walk across the gym floor, reciting all the words they can think of, starting with the letter D, while I've got a person lying in the middle of the gym floor, like rolling around and trying not to get stepped on. And yeah, some good times. And I've also seen you accumulate some really cool technology over the years, like the what is it? The equipment you put on the eyes for
Yeah, the
assessing
eye
eye movement.
tracker.
So I never actually got to play with that with you, and I'm
Oh,
kind of
it's
bummed
just
about that.
great. Next
But
time
I
you're in town.
next time I'm in town, yeah. So I definitely want to ask you more about how you're using that because I know eye movement
Sure.
is quite an interesting topic for concussion. And like I said, I'm pretty embarrassingly ignorant of concussions. I have no idea what is considered to be the standard of care, but I know that you're up to date on the latest and the cutting edge in the field. And This podcast is all about what I call movement detectively. So it's figuring out how to help your body using movement and other non invasive, self administered therapeutic approaches. And I always make sure when I'm working with people to ask them about their head injuries and concussions because we know of the impact it can have on their whole body holistically, including changes in how they move. And this can lead to areas of restrictions, but also, as you're an expert in, it can affect things like hormonal function and mental health and emotional well being. So it's kind of a big deal. Um, I personally have never had an acute concussion, but I've had probably an accumulation of subconcussive symptoms over the course of my life, which I think is pretty underappreciated in a lot of people I've chatted to. And I know that you also have a really cool story with your professional journey, and I'd love to hear more about that. So maybe a good place to start without rambling any further is
Yeah.
recent doctor, PhD, Melissa Biscardi. Can you tell me what is your actual professional title these days?
Yeah. So, yeah, it's a little bit tricky because I'm a manual osteopath and I'm a registered nurse. I come from nursing originally, and then I just finished my PhD. So, I'm a doctor, nurse, osteo.
Good combo.
But, I usually just say I'm a concussion clinician, right? I just draw from different areas that I've um, gained skills from. And a lot of my training was actually with chiropractors. So I think at a certain point, the titles don't matter as much, right? It's more the toolbox that we develop.
Mm.
So that's where I would say my professional title lies.
Yeah,
I
cool.
still feel weird using doctor because I don't know, because we usually think of medical doctor. So that's some self-limiting belief that I'll have to work through.
Yeah, well, my dad is a doctor, but his PhD was in studying agricultural science. So he's technically a doctor, but I don't think of him that way. But it's just the PhD thing. So you've come to be a concussion clinician, and I'm assuming, although I don't think I've heard your full story, but I'm assuming that something led you to be interested in concussion specifically. So what's been your journey to wanting to study concussions and help people with them?
Yeah, so I think I have a little bit of an interesting story. I when did it started, let's say 15 years ago. I've also always had sleep issues. And so when I was in osteo school, well, we always need to sleep, but I really needed to sleep when I was studying. And so I started to take sleep ease, like over the counter sleep medication. And at the time, I didn't know how bad it is for you, but it's actually really bad for our brains. And initially, I was taking it just a little bit, and then I started to take it more consistently. So basically, daily, let's say for at least a year. And at the same time, slowly, progressively, I was losing my memory. And so, at first it was small things. And then I would dismiss it. Where are my keys or what did I do, yesterday morning? And then it was getting to be more frequent. And then I started to forget patients' names and then my teammates' names because I was training Brazilian Jiu-Jitsu. Like that's when I was training all the time. And this would be people I'd known for years. So definitely knew something was wrong, but was dismissed, right? Everyone's just like, oh, it's just stress or you're imagining things, that whole invisible injury. And because I'm a healthcare provider, I was able to get an MRI, get assessed very, very easily. And what was happening is I was not being asked the right questions, right? Because no one was asking about what you taking over the counter. Or I remember saying to the doctor, oh, I'm taking vitamin D, but he didn't ask about anything else.
Mm.
And then it was just serendipity. I was talking to a teammate about sleep, and he said, oh, did you hear about that new study that shows Benadryl is associated with Alzheimer's disease? And I hadn't seen that study, but I know it now. Yeah, so I was like, oh my gosh, I literally like am giving myself dementia. So the sleep ease and Benadryl, same chemical packaged in different ways, and it interferes with acetylcholine, the memory neurotransmitter of the brain. So that got me interested in the brain, in invisible injury, and that just sort of snowballed into concussion, brain health. So I'm really passionate about people not taking those sleep um, medications, for lack of a better word, but it also shows you we take for granted the warning labels on things that are over the counter because we think, oh, it must be quote unquote safe, but everything in moderation, I guess.
Mm. So have you, at that time, had you had a concussion of your own?
I had, at that time, I did not have a concussion. I had my first concussion that I know of, probably 2016.
Mm.
So I had overcome this memory episode, and then I sustained a concussion. I already had started to work in concussion care a little bit, and I would say that helped because as soon as I got the concussion, I got a foot to the head in
Mm.
training, and so I knew what to do.
Mm.
And it was very short-lived, my concussion. I had like the ideal recovery.
Mm.
I was back in action and I want to say 2 weeks. But I do think it helped me to appreciate what people are experiencing
Mm.
because a lot of people, if you haven't had a concussion, you you don't really understand some of the symptoms or manifestations because everyone looks, quote unquote normal on the outside, but they're definitely not feeling like themselves.
Mm. I have another question I want to ask you, but you
Mhm.
mentioned that you have the ideal recovery. So before maybe we talk a bit more about what a concussion is and how to tell if you have one, and what is the ideal recovery that you experienced? What was that?
So, off the top of your head, can you think of what a doctor might say if someone had a concussion?
Ah, geez. They'd say, were you unconscious? Like, ask as you get knocked
Oh,
out
sorry, for advice, for
for
like how
advice.
to recover. Mhm.
Well, the first thing that comes to mind, I'm pretty sure this is no longer used, but don't go to sleep.
Right. Yes. Okay, that's a good one. And you're right. We don't follow that anymore. And the other, so I'll give you sort of like three things that we used to. recommend that actually are not helpful. So one is stay in a dark room,
Right.
and, and the other is just wait it out
Mm.
until you feel better. And another one would be not to sleep or to wake people up every hour. We know a concussion is just like an ankle. It does better if we engage in active rehab. And in terms of waking people up, if I wake you up every hour, how are you going to feel the next day?
Like shit.
Right. So, right. Exactly. So, we do want to keep an eye on someone, but we definitely don't wake them up. Um, so an ideal recovery would be you sustain the injury, you get checked out within the first 2 days, I want to say, because I mean, there are red flags, like if you have a laceration or vomiting 3 times, if you have like seizures, that is go to the ER. But let's say you got checked out by the team doctor or whoever, then at 2 days, we actually start aerobic exercise. So it's like the complete 360 from what we used to recommend. And it's a little bit of aerobic exercise, slowly increasing that. And with a sports related concussion, which usually they recover faster, that is going to be resolved in about 2 weeks. If
Mm.
you're sleeping at night, you're doing the aerobic exercise. Sometimes people need eye movement rehab or vestibular rehab for their balance, but usually it can be pretty quick, especially on the first one. When we have just like ankle, if you have 10 ankle sprains, the 10th one is going to be harder to rehab. Same thing with a concussion. Each one is, I don't want to say cumulative, but it just adds to the mix.
Mm. So was your recovery so quote unquote ideal because you
Mhm.
already had the knowledge about what to do and what not to do?
Yes. So I tried to stay off the screens. The first 2 days are key. Like you really shouldn't use your phone or screens for more than an hour total because it's just so stimulating, right? A screen, a phone is basically a strobe light just flashing at our brain.
Mm.
And I did take magnesium, which is great for the cells. And I didn't take creatine, but there is evidence on taking creatine 10 grams to help with recovery. And I started the aerobic exercise the next day, I want to say.
Mm.
And I think that's all I did. And then I was back to training probably a week and a half later,
Oh
which
my
might have been a
gosh.
little early, but I felt like it was pretty smooth. Yeah.
Mm.
My biggest
Cool.
symptom was definitely screen sensitivity.
Mm.
So when I was looking at it or scrolling, it was almost as if it was moving in slow motion. So I'll never forget that because screen sensitivity is one of the most common symptoms people have after a concussion.
Mm. So maybe that's a good place to segue into some foundations. I would personally love a little bit of a education on concussion 101. So maybe a good place to start is so what is a concussion and how do you know if you've had one? Because I know a lot of people that have gone to get a diagnosis from a doctor and it's very subjective.
Yes.
Some people will say, "Well, I wasn't knocked out, so it must not be a concussion," but we know you can have a concussion without getting knocked out and I just don't know how is it that you know these days that you have a concussion. So maybe you can fill us in on that
Yeah. Well,
information that's a little bit nebulous sometimes.
yeah, you're bang on because we don't have a diagnostic test. It's based on clinical interpretation, essentially, of the event and what happened. There are criteria um, that technically can say you had a concussion. So one is there has to be an event where either you hit your head or your body's shaken enough that it would cause enough force for the brain to sort of shake inside the skull. The other is that you have to have acute symptoms such as feeling nauseous or headache, and also signs. So that might be disturbance in your balance, or if someone is checking your eye movements, the eye movements are usually disturbed. And also that whatever is being experienced isn't explained by something else, like
Mm.
intoxication, medication, or whatnot. And so whoever's assessing you or whoever takes into account that history and then decides if it, passes the threshold. So it really is subjective. And that is challenging
Mm,
because let's say you didn't have a concussion, but then you're thrown into the idea that you have a concussion, you might end up getting unnecessary treatments. And even like the psychological stress of thinking you have a concussion is huge.
mm-hmm,
But then on the flip side, if you don't get the concussion diagnosis and you just go running wild, that's not good either.
mm,
So I know there's some research on testing the saliva, which would be amazing, um, so that people get triaged properly.
mm. What would they find in
Um,
the saliva? Would it be some kind of marker of inflammation or something like that?
yeah, that's a good question. Is it a mark? It must be a marker of inflammation. I'm thinking I should know this, but I don't. I know the research is happening in Canada. It's like McGill or something like that, which is pretty cool.
Mm. So, just going back to what is a concussion. So, you
Mhm. Oh,
mentioned there's
yes.
an event and it's a
Yes,
trauma to the head, but it's not sufficient for it to be just a bonk to the head. What actually has to
exactly.
happen for it to be considered a concussion?
Yeah, so it's really interesting because in terms of force, the force for whiplash is way less than concussion. So the force to sustain whiplash is around 6 to 8 G's of force. And just to, like, what does that even mean? If we plop into a chair, that's 10 G's of force.
Mm,
But the reason why we don't get a concussion every time we plop into a chair is because we know we're going to plop into the chair.
right.
Or a sneeze, I think, is like 2 G's of force. So whiplash is a big sneeze, right? Whiplash is, let's say, 6 to 8. A concussion is 75 to 85.
Wow.
So you actually need a good amount of force to sustain a concussion. And so the force comes through the body or to the head, causes the shaking of the brain. Um, and then you have a metabolic cascade that happens. So a release of chemicals in the brain, excitatory ones. And that is why sometimes people will see stars or they'll feel dazed. The thing is with those excitatory neurotransmitters, they go up and then they settle really quickly. So you might feel dazed, then you feel fine, and then you think, oh, I'm fine.
Mm,
So that's where that experience comes from.
mm,
But then the whole inflammatory process, it takes place over weeks.
mm,
So even if you feel better and you return to play at 2 weeks, you're not 100%. It takes 4 to 6 weeks actually for the brain to kind of settle. So there's this window of vulnerability. So it's really interesting when you see the American football players or hockey players being put back into the game because technically they're still vulnerable. And we see the
mm.
repeated injuries happen. So that it's a little bit concerning.
Yeah, well, then you're a naughty girl for going back into
I,
BJJ a
I
week
was
after.
definitely. I know.
So, just to backtrack again, to help me understand, so the concussion, about 75 G's of force.
Mhm.
That's not
Yes,
necessarily direct head impact. It can occur if you
through the
fall
body.
and your head just gets jostled sufficiently. And then,
Yes.
is the concussion itself kind of like, you know how a wound heals and it brings blood to the area to nourish it so it can heal? Is the metabolic cascade and the inflammation, is that part of, you could say, a healing process that's
Yes.
necessary?
Yeah, absolutely. I would say it's similar. And one thing is during that process, there's a disruption in the blood-brain barrier. And so the health of the person when they sustain a concussion matters because if you
Mm,
are full of inflammation, maybe don't have the greatest diet, then the system is not necessarily set up for successful healing. And
mm,
if you talk to 10 people about their concussion recovery, you'll get 10 different stories. And it is because everyone is individual
yeah.
and how they are at that specific moment that they sustain a concussion is going to impact their recovery.
Mm. So a good portion of the recovery, I mean, you said 4 to 6 weeks. That's also a similar time frame for wound healing or tissue healing
Oh,
after any
yeah,
kind of
absolutely.
injury. So is part of concussion recovery, would you say it's optimizing the conditions of your body so that that healing process is not interrupted and your natural healing processes can do the job they're meant to do within that time.
Yeah, I would say that's pretty accurate because also the brain is using more energy to heal,
Mm.
but producing less energy. And
Mm.
so respecting those conditions as well is going to promote healing.
Yeah.
I guess similar to, I mean, I know nothing about the foot, but I know you're the expert. But creating optimal conditions there, which is probably not doing a race after you've injured your ankle, or I've seen you do a lot of, I don't know if it's rehab or optimization on your own body.
Mm.
So I do think there are a lot of similarities. Like the brain is very complex, but principles of healing,
Yeah.
I think, apply throughout.
However, it must be harder with the brain because it's not as if you can just take weeks off of using your brain completely. You still have to use it. It's not like you can just elevate your brain and ice your brain and all those typical things you would do if
Yes.
you broke your foot or something. You have to continue on with your life, so it does become a little bit more complicated.
Tricky.
And I'm sure you have quite a few complex cases that you've worked with. And I was curious if maybe just to set the stage for your clinical practice, if you could tell us a story about a challenging or complicated case that ended up being a success, hopefully in the end, but maybe along the way you both learned something about the the complications and like real life. There's the optimal ideal way that we know someone could recover, but life isn't like that. You're gonna have some ups and downs along the way. So do you have anything that comes to mind that you could share about someone you've worked with?
So, who should I choose? Um, well, because I'm thinking, should I choose someone who is sports related or motor vehicle? Motor vehicle accidents are always, or I want to say 99% of the time, more challenging because there usually is other injuries going along with it, right?
Mm.
If you can imagine they're being restrained by the seatbelt and the torsion going through their body. But let's say a sports injury. I get actually a lot of frisbee injuries. Ultimate frisbee is um, more dangerous than you think. So I had a patient who came in and he had ultimate frisbee injury, and he was also a teacher. So, right, exactly, because people have lives other than playing their sport or their activity. So he came in. It actually wasn't his first concussion, so he knew to kind of seek out care early. And then we started on the protocol. Aerobic exercise, there was a lot of neck involvement because remember, the amount of force for whiplash is less, so there's always a neck injury with concussion. So we did some neck rehab, some eye movement rehab, slowly got him into sport-like movements to prepare him for going back to sport, and pacing. So we talked about how you can't rest the brain, but we definitely want to have a lot of breaks and then slowly build the person up. So we slowly built him up to like a full day of work. But usually in the early stages, depending, it might be no work at all for a couple weeks. And then we usually start with Monday, Wednesday, Friday, half days, and slowly building it up, depending how they respond. I want to say his recovery was it wasn't 2 weeks, but probably 4 weeks maximum. So I consider that pretty good for
Hmm.
someone who is an adult and has all the responsibilities associated with that in addition to a sport. Because sometimes with the younger, let's say the teens, yes, there's school, but it's not quite the same as having to pay rent and stuff like that.
Mm-hmm. So
Right.
that sounds like kind of a cruisy recovery. Do you have any
Oh yeah, you
stories
asked for a
of,
challenging one. Sorry. Okay.
yeah.
Okay,
But that's good
so
to
I'll give
hear
you
that
one.
people do have nice, smooth, linear recoveries that, yeah.
Yes.
Uh,
Okay. So let's contrast it with another one. So this would be a lady. who was in a motor vehicle accident, actually, rear-ended and was having terrible light sensitivity, migraines, couldn't work. And the recovery was pretty long. I want to say maybe she started to see me a year into the injury. So
Mm.
sometimes people are finding me later. And we did what I just described. So it's a similar approach, like no matter when you come in, it's like what is driving the symptoms, what is suboptimal. So it's usually the neck. We did some eye movement. Vestibular was not so impacted. Because I'm a nurse, I do acupuncture sometimes. So we did a little bit of that. A lot of manual therapy in the dark. This is someone who was like super,
Mm.
super sensitive. And then slowly she needed less treatment, and now she's free. I think she just got married. Yes, and I never see her, which is sad, but also happy.
Mm. Yeah.
So, and she surprised me because she was so severe. Like when you have a patient who's coming in, like they cannot tolerate a pin dropping, like that
Mm.
nervous system, which you know so much about. The nervous system is just so amped that the slightest thing the nervous system is perceiving as a lion. It's pretty challenging, but I thought, oh, I wonder how much better she's going to get.
Mm.
And she showed me,
Mm.
right?
Amazing.
So, and it just shows you that the resilience of the human spirit, really.
Yeah. Oh, that's a huge component. I want to tell you a story that maybe you can
Yes.
comment on. So I had a friend who also was a client of mine momentarily, but kind of just for fun because she was a friend. But anyway,
Yes.
so she was a dancer, and her concussion story was at the end of a piece, they had this final pose where they had to drop quickly to the floor. So she ended up slamming her head into the ground and feeling pretty like, ooh, that was a bit of an impact. So she went to the hospital, and the doctor said, oh no, you're fine. So then she went on with her life, and over the next, I don't know if it was a day or a few days, but regardless, over the next period of time, she noticed that she still had symptoms, just felt really shit, nauseous, etc. Brain couldn't function. So she went back to the hospital, and a different doctor said, oh, you definitely have a concussion. I don't know why that wasn't diagnosed earlier.
Yeah.
And it made me wonder about the standard of care. How how does
It's
what
so
you
variable.
do, maybe you can comment on that, and maybe the way that you diagnose and look at a concussion differ from if you just went to the hospital for it? And would you recommend that people go to the hospital, or can they just for themselves make a judgment call and then go see someone like yourself?
I would say definitely. Um, so what are some red flags where I would say you absolutely have to go to the hospital? One, if it's a motor vehicle accident. If
Mm.
it's someone over 65, that's also considered a red flag. Any bleeding, if you lose consciousness, vomiting 3 times. So vomiting once is considered acceptable, but vomiting 3 times or projectile vomiting, these are signs that the system is really, I want to say, unstable. A worsening headache, like I said, like seizures, tremors. Those are most of them. That
So
is like go.
vomiting 3 times within what time frame?
Oh, that's a good point. I would say I actually don't know specifically, but I would say the same day.
Okay.
Um, then So go to the ER. If you sustain what you think is a concussion and you don't have those, it's still a good idea to circle around with someone, not me, because I don't diagnose.
Right.
So people will usually come in with the diagnosis already or come in and then I say, well, circle around with your family doctor.
Okay. Good to know.
Um, yeah. And then, so looking out for those things for sure. But then it's really challenging because you just like you just pointed out, you can see two different doctors and get two different opinions on what happened. So if you can, now it's better in Toronto a little bit. Um, if you can seek out a physician from a concussion clinic, that would be good. Yes,
Mm-hmm.
and then find your way to. The rehab. 'Cause physicians don't do rehab, right?
Mm,
They are medication suppliers or they refer. Like that is their job. So um, we shouldn't expect more from them, but that means that you have to seek out someone who can provide rehab. And I will say, so for example, me, if I have someone who has issues, like I think of you as being the foot expert, and I know there's more to it, but and movement expert. So I would say, oh, I would not try and rehab that. I would say go see Monica
mm,
because that's what you deal with all day long.
mhm,
And similarly, if you sustain a concussion, it's a good idea to see someone who that's what they're doing very frequently as opposed to, you know, one or two a week because repetition, right? It's like the 1,000-hour rule or whatnot, but it is a bit of the Wild West. How is it where you are?
I
Because
actually
I
don't know.
Yeah, interesting.
I'm not sure, and I was going to ask you because I've recently seen a few like here Australian football AFL or footy is really
Yes,
popular,
which is
and
soccer for us.
it's actually more like rugby.
Okay, yes.
Yeah, and so it's very high contact, lots of tackling and jumping on each other, and there's no helmets. And I've worked with a few teenaged footy athletes here, and their necks are all just like kind of compressed and fucked looking. And I
Oh,
think
I'm
it's
so
kind
glad
of
you brought this up.
insane they're playing this full contact sport with no helmet, but also, I mean, I'm pretty sure that 80 to 100% of them must have gotten hit in the head at some point or just had a pretty severe knock that's up to at least 75 Gs. But
Yes.
do helmets actually do anything to reduce concussion risk?
So the helmet protects you from more like a skull fracture. It doesn't really protect against concussion because the concussion is the shaking of the brain.
Mm-hmm.
We can't, so in terms of concussion prevention, like definitely those gimmicks that wrap around your neck, like there's a new band out. So here's the thing. We need to use common sense, right? So, and it's really crazy because unfortunately, some companies are just taking advantage of the fact that people don't want to get a concussion. But if it seems like it's too good to be true, then it probably is. So a little band around your neck is not going to help. There's these, I think it's even called a skull cap. It's like a little cap that goes inside your helmet. Just remember, it's the shaking of the brain inside the skull. That is a
Mm-hmm.
concussion. What you can do to not prevent, but to set yourself up for success is actually neck strengthening because it's the neck that slows the acceleration of the head on the neck. And so working the deep stabilizers, like not the SEM. So if you look up like deep cervical neck flexion test on YouTube, the that you can test yourself, and then the exercise is essentially the same thing, working those deep stabilizers that kick in before you even know what's going on. So that is one thing we can do proactively, especially you said these players are coming in like fully extended. Some of that
Mm-hmm.
might be from the phone use and tech use, right? Which is like this sometimes. Um, so these are like non-existent, the front neck muscles. So like really working them can be helpful.
Mm-hmm.
So even
Yeah.
you, when you're working with them, you've already noticed. So just like that's one thing you can do because for sure they're getting jostled.
Yeah.
Even if we call it like subconcussive blows, it's like if you have 100 sub noticeable ankle sprains. I always use the ankle, but it's like anything, right? If you hit your elbow 100 times, that elbow is not going to be great, even if you never broke it.
Mm. So, what do you think, just piggybacking on that, what do you think are some scenarios that people might not expect would contribute to a concussion? You mentioned that
Mm.
it's not just a head injury necessarily, but it's the jostling of the brain. So, what are some things that people might not think about that they should consider?
So do you mean, for example, the fact that neck strength matters?
That neck strength matters, but maybe there are scenarios where
Yeah.
someone might have accumulated
Yes.
subconcussive symptoms, but they
Hmm.
can't remember having a fall or anything. But over the years, maybe they've had enough events that they wouldn't expect contribute to a
Yeah.
concussion. So what other kind of things should
Well,
people consider?
definitely, of course, sports, like you said, like your athletes, it can add up. I have had patients come in and they will have a more recent concussion. And then as time goes on, they remember something that happened when
Mm,
they were a kid. Um, or that they always used to, let's say, fall and hit their head as a kid, but it's way back in the memory. So some of those things, just like a history of clumsiness, where you know what, people are hitting their head around the house all of the time, but I don't know if they're hitting their head repetitively in the same way as sports injuries. But you know how I said it's like the state of the person matters. So sometimes, okay, there's this 75 G's of force, but if your system is really struggling, even just with other health issues, then that sort of room for error, I want to say, is a little bit smaller because at 75 G's, not everyone will sustain a concussion. It's
mm,
like that's the average threshold, but some people need more. So it's kind of about building up your resilience,
mm,
which is being healthy. As my colleague Mark says, being healthy on purpose, right? It's
interesting.
like you don't know it, but maybe you actually prevented yourself from
Mm.
sustaining a concussion.
So what does that specifically mean, being healthy and resilient to concussion? How do you know?
So here's the thing about resiliency is that you don't know because you never develop the thing,
Right.
right? So it's kind of a catch 22. But if, I wanted to set myself up for the best resilience against concussion, it would be neck strength, posture, right? Because posture is the same. It disrupts the position of the neck, which is key in concussion recovery. Things like it's all the stuff that isn't sexy, right? It's having a good diet. It's being rested. And I want to say even just like getting quote unquote tune-ups because we never perceive our deficits, right? Because we're living in the body. I don't want to say never, but often there are things we don't notice. So having someone from the outside kind of assessing and saying, oh, well, this could be a little bit better. You could be functioning better, I think can be helpful.
Mm-hmm.
And that's just not just for concussion, but
Mm,
like, what do you recommend to your clients who are feeling good?
mm. Yeah, and they just want to feel a little bit more optimal.
Yes.
Yeah. I
Or
mean,
they can be more optimal.
yeah, well, I guess like you said, you want to make sure that your body is in more or less a balanced alignment.
Yeah.
If someone comes in and they have kind of the more obvious presentation of their head is way forward and they're standing leaned all the way to one side and they feel pretty good, I'd say maybe, well, if you're here to feel better and you already feel pretty good, I bet you'd feel a little bit better if you were standing with your head over top of your feet and not leaned all the way to one side. That might feel a little bit better. Um, I'm thinking with concussions, I could definitely see how if you're more in a head centered alignment, that would be more ideal if you're already kind of off kilter and then that 75 G's or higher or less of force
Mhm.
sloshes your head around a little bit more. And as part of recovery, you mentioned that in every whiplash, or sorry, in every concussion, there's an element of a neck injury. So part of their recovery would involve realigning, re-strengthening their neck.
Yes.
Can can the concussion itself, like the brain injury, can that heal without doing anything with their neck, or is that a really crucial part of it, just from the health of the nervous system tissue, or do you really need that neck to be in an optimal position for blood flow and that element of it?
Yeah, I would say you. definitely have to pay at least some attention to the neck. Exactly what you're saying for blood flow. Also, when that neck and head are jostled, what can happen is the how the joints communicate are that's disrupted. So we call it joint position error. So where you think your head is and where your head actually is can be disrupted. And that's just miscommunication that your brain doesn't need.
Hmm.
So usually you need to rehab that, or
Mm,
also the neck strength. So I would say it's really unlikely that there would be a concussion recovery that didn't need anything to the neck,
mm,
especially today, because just um, how we are living in non-ideal postures,
mhm,
there's usually some vulnerability there that needs to be addressed.
mm. And is it true too that if you have not completely healed a concussion and then you have a second one, which actually happened to my friend that I told you the story about earlier. She had a second concussion. Um, I think within that healing, the initial healing phase of her first one, which complicated things, and she had to take a lot of
Yes.
time off. So, and that could, if your neck is in a off balance position from the first one, it's further weakened, you could say, and less able to tolerate a second blow, and that might make
Yes.
it worse again, on top of already being in a compromised state from the concussion, just the neck being less able to tolerate the force of a second blow. I could see how that would be very important. Is that true, you'd
Yeah,
say?
absolutely. I wasn't even thinking down that pathway, but you're absolutely right. And also, if it's really soon after, like within 2 weeks,
Mm,
there is which I didn't follow, but within 2 weeks, if you sustain two concussions,
mhm,
you can have a really bad outcome,
mm.
essentially. So now I would never do what I did before, but really,
Go
you
back
know,
to a martial art within one
yeah,
week of having a concussion. Yeah. You must have been really
not a
confident
good idea.
in your body at the time.
But there is that window of vulnerability. But yes,
Mm,
exactly what you're saying. Plus, if the neck has not been rehabbed, and so even more force is generated just by nature of that neck not being
mm,
able to slow the head down. And then as you're recovering, your battery is not quite full.
mm,
And then the second injury makes that battery even less full.
mm.
So that definitely is not the perfect situation. A concussion, no matter what, is usually a roller coaster
Yeah.
because you get some traction, some recovery, push a little too much because you're feeling good, and then
Mhm,
your brain and body say, hold on there. And then you go up again. So it definitely can be frustrating for
mm,
people because they'll
mhm,
feel good and then they won't feel good. So it definitely can wear down. That's why mental health support is really key. I always am referring to like mental health support because it is a trauma, right? You're living your life, having fun, and then this thing comes and sidelines you.
mm,
It's that holistic approach.
mm. I want to come back to that, but
Okay.
before we do, I don't want to forget that I want to reiterate something that you said just to make sure I understand it about the because a lot of people that are listening to this, they have a movement practice or are curious about movement practices to improve their posture and movement quality of their body in a balanced way. So, is it true to say that if someone is proactively using a movement practice to have good mobility in their neck, good alignment of their head over their body, not forward, so everything is strong and balanced and mobile, would that put them in a situation or a position where they could be more resilient to like take being able to take more G's of force with
Yes,
less problems?
absolutely. And also,
Okay.
while you didn't say it, but the mobility of the spine. And so
Mm.
I like to use the concept of room for error. So, for example, if you got to jostle, I'm assuming your body's pretty good,
Eh,
mobile, aligned
maybe.
on, on some days. So, if you get a hit, it's that body is going to almost like let it roll off.
Mm,
If you are a block of cement, and the force hits you, there's no room for error. So I
mm.
definitely think that the mobility work, the movement practice is prevention practice.
Right. So people that do contact sports, BJJ, AFL, soccer, football, whatever it is they do, and they know that at some point in their game in their
Mhm.
training, they're going to be having head impacts, falls. Probably they should be including some kind of neck and spine mobility and strengthening practice into their routine.
Yes, absolutely. Are
Yeah.
you doing the Eldoa still, or
I
do you use
am
something
doing
else?
Aldoa.
Yes.
What do you think of
Yeah.
that
Yeah.
for concussion prehab rehab?
Yes. So I'll put a little fine print in here. If someone is hypermobile, then basically everything I said doesn't apply, um, because they need stability.
Right.
But for the rest of the population, things like Eldoa, which help to support the flexibility of the dura, I would
Mm,
say, um, and just the mobility of the spine. I think that is amazing for
mhm.
setting yourself up for resilience.
Yeah.
And I do include, so unfortunately, it's hard to sell prehab, right?
Mm,
So I don't get a lot of that, but I include the Eldoa as part of rehab because the
mm,
idea is not just to get people recovered from the concussion, but to get them to the ideal state. So I really
mm.
do like the Eldoa.
Yeah. So maybe people who don't know what Aldoa is and why it's helpful, can you explain a bit about that?
Yes. So
I forget
Eldoa
what it
is,
stands for. I know it's a
yeah, it's French.
French acronym.
Um, yes, I have no idea. Elong something, decoaptation, something or another. But basically, creating space between the segments of the spine. So there's a posture for each segment, and what do you call it? The point of focus is the fascia. How would you say that? Like the intention is on, or the lever is the fascia to create space between
Mm,
the vertebrae and essentially stretch the
mm.
dura.
Yeah,
And it's best done.
I always think of it like really specific yoga postures that target an individual joint with the goal of creating space, decompressing it. So each segment of the spine and neck, there's a specific position that you can sustain that will over time begin to decompress the joint. And there's also an Eldoa position for, I think, every joint in the body. So why is that beneficial for a rehab for concussions? What does that do?
So definitely works to get people back to that room for air point. But when you do the postures, especially at night, you create the space, and then overnight hydration happens
Mm,
to those discs. So that is really important. And then the postures for the neck, creating that space after the whiplash, can be really beneficial as
mm,
well.
right.
And most
Cool.
people also need it at the L5S1,
Right.
right? The lowest point in the back, just because gravity, we're all fighting gravity,
Yeah.
creating some space there.
Yeah.
So,
So maybe something that I wanted to ask earlier, but we got a bit sidetracked with cool stuff is if someone has had a concussion, let's say hypothetical situation, someone's just had a concussion. They're not sure if they do, but they suspect, oh, these symptoms sound a bit like what Melissa was describing. What are three things that someone, or more, but three things that someone should do immediately if they suspect they've just had a concussion?
okay, so let's say they had no red flags. So I would say one, limit the screens as much as possible. Um, Two would be, well, have a get a good night's sleep that night. Eating like super healthy, right? No alcohol. It seems like a no-brainer for lack of a better word for me, but actually people take that for granted. So no alcohol, right? Nutrient-rich foods, probably high fats like avocado, fish, and take it easy. Don't put yourself in a dark room, but you're just going to take it easy that day and the next day. So audiobooks are okay. Might be too energy intensive to read.
Mm,
Audiobooks, you can go for a walk. So we call it relative rest as opposed to like cocooning.
mm. So, why did they in the past recommend, or maybe still do, that you not go to sleep or you spend time in a dark room or you get woken up every hour? Why was that given as advice?
So I don't know why the waking up thing was a thing. I'm assuming it was to check if people were alive. I don't know. But um, for the dark room, I think that was around like the brain needs as much energy as possible to heal. So they thought, okay, well, if we take out any stimulus, that's definitely going to be the right approach. But when you think about it in another way, like, is there anything where we just cocoon it when we injure it? No. So we rest a little bit and then we do some active rehab. The other side of it is if I put you in a dark room for a week, how are you going to feel? Right. So
Yeah.
there are all these other pieces of it, like social isolation, which then can lead to depression, anxiety. So the movement part is so key, even for creating sleep drive. The key is not to overdo it.
Yeah.
Slow and
And then
steady.
the not going to sleep thing, why was that?
To be honest.
Was that because they thought that you might just not wake up if your brain's
Yeah,
damaged?
I think that is.
Which is that true or?
I'll have to look it up after, but um, yeah, it seems odd.
But that's pretty old school advice, so don't worry about that.
Yes. But here's the problem is, education moves slowly.
Yeah.
So, and it's hard to change beliefs or things that we heard. So some people will still be like, oh, I need to wake, so and so up every hour. Oh,
Mm.
you need to rest until you feel better. So a huge piece is like spreading the word that actually we do things a little bit differently.
Mm. So what I'm
Can you
hearing,
think of another case? Oh, sorry, say your
yeah,
thing and
no,
then
go
I'll ask
ahead,
you
go
a
ahead.
question. Oh, like, I know there are other examples where we used to think that this was the best way and then kind of took a 360. And I mean, even now, this is what we think is the best way, but
Yeah. Is there other bad advice being given about concussion care that you can
or
think of?
even anything. Like, is there anything that you can think of where we switched? Well, the food pyramid, that's one,
Yeah. Tell about that.
right?
You mentioned
So
high
I don't,
fats are recommended for recovery. Is that because the brain is, well, it's like a clump of fat. So are
yes.
you helping the brain to function better by giving it fat-rich foods? And I think I've
Yeah.
even heard recommendations of a ketogenic diet is
Oh,
helpful
yes.
for recovery.
Yeah, so I want to say maybe there's a little bit of evidence for that, but most of it comes from the fact that there is evidence for other neurological conditions that ketogenic diet can be helpful. The one thing about that is that it's hard to maintain.
Yeah.
So we do know the Western diet is not great, but even like that's why I say just eating healthy um, foods, fruits, vegetables, low sugar, try and keep the carbs down and lots of fish because that is for most people feasible.
Mm.
If
Why
someone
is
is like, I will do anything you say, then I will say cut the dairy, cut the gluten,
why is
and
that? Is that because of potential
like
inflammation
inflammation.
or?
Yeah. And most people feel better, like in general, if they have a little bit less bread and pasta.
Yeah.
So I've had patients that have either stayed like gluten-free or just continued to limit it because they felt so good.
Mm. Yeah, it's got to be hard because, like you said, it's not easy not being able to do the things that you love while you're resting.
Yes.
And then you just want a bit of comfort. Like, I just want some cookies to make me feel
Yes,
better.
absolutely. Some
But
more bread.
why is that not great to do? Like, you need energy
Yes.
and sugar seems like a really good source of energy for your brain. So why would that not be something that you want to do?
Yeah. So mainly because of the inflammatory um, effect. So we need some sugar, but healthy sources of sugar, like fruits, or if people, I usually don't have people restrict coffee 100%, but I
Okay.
will say just have it in the morning and try not to have all the other junk in it
Mhm.
that people. put in coffee, because if you tell people to stop having coffee when that's part of the routine, then you can get the rebound headache. So
Mm.
it's all about meeting the person where they're at.
Yeah.
And I'm sure you can think of people you've worked with where it's like, well, if I could turn their world around, we'd do it this way.
Yeah.
But
That's not realistic. Yeah.
can you
I'm
give me an example of that?
uh most people, to be
Right.
honest. Yeah. Well, I'm just thinking of the I'm not going to name names, but the client that you referred to me to do a bit of craniosacral with, and how up and down their journey was. And this also segues into a bit I wanted to ask you about aerobic exercise. And I remember in this person's case, you recommended do some aerobic activity, but concurrently to having this concussion, they had a big toe issue that was limiting the ability to walk and get around. So when you have another injury on top of a concussion and you know that you're supposed to do aerobic activity, but you can't, like in a perfect world, you'd go for a walk or get on the bike or do whatever you can for aerobic activity. But if you can't do anything, then what are you supposed to do? It's not always so uh, linear and
Yeah.
easy to follow. So maybe could you say a bit about what is the role that doing, you mentioned aerobic exercise, or maybe you didn't say aerobic exercise, but you said exercise is important as part of the recovery process. So why is that
Yes.
something that people want to
And
do
it
and when
is.
should they do it?
We can start as early as 48 hours.
Mm.
And we will usually say up to 20 minutes a day, and aerobic exercise at a really easy peasy pace. And how you can monitor this is we don't need people to have no symptoms, because if you wait for no symptoms, you'll never move. So on a scale of 1 to right, on a scale of 1 to 10, if they have a symptom from 0 to 3 or 4, that's okay. So if the headache is there, it's a little bothersome, but not too bad, they can keep walking or on the bike. And then the other thing is perceived effort. So if you're on the bike, easy peasy, but you feel like you're running a marathon, then that's a huge mismatch. So I usually say do a 2-minute cool down and then try again the next day. And usually for heart rate, it's like quite low in the beginning. So I want to say like 90, 95.
Mm.
So really it's low effort. And there's a whole progression, what would you call it? Protocol, for lack of a better word. But even without that, it's aim for 20 minutes a day, easy peasy, getting the blood flow circulation going. And what is it called? Neurovascular coupling. So it's just this process in the brain that we're supporting. And then the flip side of it, like I mentioned, if we're not moving, we're not getting the sleep drive. And if we're
Mm.
not sleeping, we're going to feel even crappier.
Hmm.
And the aerobic exercise is good for the mood.
Right.
Usually I recommend the bike if people have access to it, because there's no bouncing or anything like that. Other than that, walking, treadmill can be hard for people.
Mm.
So that's why I start with the bike. But if you have a toe injury, that is hugely limiting.
Hmm.
I was just thinking, what could that person do? And it wouldn't be ideal. Like maybe laying on the back doing bicycle,
Mm.
but it's really going to be challenging. Actually, that could be one for like shadow boxing,
Mm.
something just upper body. Even a little bit of movement is better than no movement,
Yeah.
but you know that much. Can
What
you think
about
of
one of
any?
those, those
Yes,
hand bicycle things? I mean, I'm
yes,
not saying go out and buy
absolutely.
one of those, but I'm thinking those, I've used one.
You have
Those get your
access
heart rate up pretty good.
for
Um,
sure.
or what about swimming? Is that
Oh,
something that
yes.
would be too challenging, especially if you have some neck involvement? Would that be difficult to do?
I would say probably in the first, like for the first at 48 hours, that probably wouldn't be tolerated well.
Mm.
But in, let's say, roughly 2 weeks, people like swimming. They tolerate
Hmm.
it well. So, especially if they were swimmers before, like me, you will not get me in a pool, no matter what injury I have.
Hmm.
But yeah, swimming is a good option for sure. Or walking in the pool can
Yeah.
be good too, because you get a little bit of resistance. Um, that's a
And
good option.
what did you say was if you were using like a rate of perceived effort,
Oh, yes,
what's
sorry.
the effort people should get up to for that kind
We
of recovery?
it's it's supposed to be so on a scale of 0 to 10, you can actually go up to an 8 out of 10 in effort,
Okay.
which is pretty
So
high.
pretty intense.
Sometimes, yeah, and sometimes I like to use just the green, yellow, red.
Mm,
So green is like no effort, so
mm,
keep going. Yellow is medium effort, and then red is like, oh, this is pretty effortful.
mm,
And the same, you can use that same guide for symptoms. Green is like you don't even notice them. Yellow is they're there, but I can manage. Red is unbearable.
hmm. So you should be shooting for like the yellow, maybe a bit of orange, maybe
Exactly.
not too much in the
Exactly.
red range.
Exactly.
Yeah. And
And
just
that
to
way
kind
you're
of,
leaning in to, you're leaning into it, but you're not like, so there's this whole idea of running to the fire, running to the danger because of, I forget her name, Sarah Polly. She wrote a book and there's a chapter on her concussion recovery. But the problem with that is it doesn't work for everyone, like running into the fire. So, there has to be some what do you call it, boundaries to
mm.
that. And I think like leaning in is perfect. You're challenging the system, but that way you can avoid a crash as much as possible.
How would you know if you're going too hard?
So oh, this is such a great question. So usually I will say if you lean in and okay, spike your symptoms, but they come down within an hour, like down
Mm,
to the green range, then okay, you pushed yourself, but it was okay. Go
right.
back, do the same thing the next day. If you push yourself and you're down for the day, then you pushed yourself too
Mm,
much. So the next time, just pull back a little bit.
mhm.
It
Yeah.
really is an ebb and flow,
Yeah,
I
it's
will
really tough
say.
to calibrate that to
Yes,
know where is the threshold when you've never tested
yes,
it. So you kind of need to test it a bit,
yes,
but you don't want to test it too hard and then have a discouraging setback, which happens a lot, I'm sure, with
yes.
concussion, figuring out what's the sweet spot for where you want to be. How much can you read? How much screen time can you tolerate? How much sugar can you tolerate? How much exercise can you tolerate? It must be such a dance where you're just figuring it out as you go with a lot of people.
Yeah, and you know what's interesting too? So before I ask or say what I'm going to say, what is the um, age range of people you see? Is it, from one end of the lifespan to the other, or?
Yeah, pretty vast. I would say the youngest person recently I've worked with is 14 and the oldest would be 70 something.
And so you know that there are different life responsibilities throughout that whole
Mm,
lifespan. So that's the other thing that we have to take into consideration when guiding people through concussion recovery. Like moms or people in that home, what's it called, caretaking role, that is super challenging,
mm,
right? Just having so many things to manage, kids, and then trying to recover from a concussion, that's very challenging. So when it comes to the recovery, we're going to work it a little bit different than the high school athlete or the single guy or gal who just has a little more bandwidth to lean in.
mm.
So it really is like super individualized approach, which is why I tell people like don't hang out on the internet too much because it really is a biased look. And the other thing is concussion recovery groups, they can be helpful, but you are only talking to people who have not recovered. People who've recovered, they're not in those groups. So I always think that's right. It's super, or usually
Mm,
they're not. It's super important to remember that there are people out there who they've recovered and they're doing the things they love.
mm. Yeah. I wonder if you have any insight on subconcussive symptoms. And my personal experience with that is never having had a large blow to the head that I felt caused a concussion. But when I thought back on it, I've had a lot of medium, like you could say, in the yellow to orange range of concussions, not concussions, of head blows and whiplashes and being kicked in the head in dance training and things that I just overlooked. And then I remember having a craniosacral session, and the practitioner I was with at the time, she asked me, "Have you had a concussion?" Because for her, it felt like the quality of the compression of the cranial bones and how my membranes felt restricted to her. She said it felt similar to people that she's worked with that have had concussions. And I was really shocked about hearing that. But then after the session, and she'd done some work on various cranial bones and my neck, and I felt like I had a new brain after that. And I would have not known that there was a different normal that I could operate from if I had not had that initial session to feel the contrast between the two. So, do you have any advice for people that maybe they haven't had a concussion, but they have had a lot of knocks to the head over the course of their life, or they've had whiplash and it's never been treated? Is there anything that they can do, or what would you say for that kind of person?
Yeah, that's a great question. And I want to say like the jury is out on subconcussive hits, and
Mm,
also number matters. So in soccer, let's say, or footy, they're getting, let's say, 3,000 over the course of a lifetime versus 20. It definitely, there's a different magnitude of effect. But for regular person like yourself, accumulated some bumps and bruises along the way, I think going to a craniosacral therapist is like an amazing idea, right? And we all need it, but help to normalize the tissue, restore blood flow, circulation in ways that maybe you didn't know you needed. And then also bringing it back to like the low hanging fruit, just supporting your system. Because even, well, like we said, two people can get 75 G's of force and not both of them will get a concussion. So same thing, I think, with subconcussive hits.
mm,
It's like you might have 20 and you're fine because you've taken care of
yeah,
your system, and someone might have 5 and later on they're not doing as great.
yeah,
And it's, yeah, it's definitely not in isolation.
yeah. And I remember I was listening to an interview with someone who studies CTE. What is that?
Hmm.
Chronic something
Traumatic
chronic traumatic encephalopathy,
encephalopathy. Hmm.
which there was a movie about. Concussion
Yes,
was based on those findings in football players that then they had
yes.
mood disorders and some of them took their lives due to it because of the amount of brain damage they'd had over the course of their careers. And I remember I forget who the doctor was they were interviewing, but he said that the only way of really diagnosing it was post mortem, like
Yes.
after they were able to open up the skull and see the brain. And so I'm wondering, is it just safe for everyone to assume they've had some kind of, not
Traumatic.
CTE, but some kind of
Right.
subconcussive or concussion symptoms that they should just do
Look out
some
for.
things to see
Yeah.
if they feel better doing?
So there is a, like, yes, we can't diagnose it until after death, but there are some huge, huge clues.
Yeah.
So when you think about football players, it's a lot of hits to the head and hits to the front part of the head.
Mm,
And the frontal lobe is very much attention, inhibition, mood, right? Things like anger, irritability, um, creativity, hope, executive functioning. And if you think of some of those athletes, like you're saying, they took their life, but also angry outbursts, right? Abusive to their partners.
mhm,
And that you can think of as not having inhibition, right? Like if I'm mad at someone and I want to throw the water on them, but my brain says, no, that's not going to be a good idea. But if our frontal lobe isn't working, I will throw the water at them.
mm,
So sometimes it's not the person who noticed, it's the partner. Like you're not the
mm,
same as you used to be. So that can be the clue, the partner's observations, but also you checking in with yourself. Like, do I feel like myself? Am I having mood issues that weren't there before?
mhm.
And maybe you don't have CTE, and actually you probably don't, but it's telling you that. So don't freak out, everyone. But it's telling you there's something that's suboptimal in the system
Mm.
that we can support.
Yeah. And you know what that just made me think of is another area that I know that you've learned about and you educate about is the hormonal state that you're in when you've had a head injury. And I was
Mhm.
thinking about a lot of the symptoms you just mentioned. They can be normal symptoms, or maybe not normal, but common symptoms of perimenopause. You start to have mood disruptions if you're in the phase of your menstrual cycle where you have a bit of moodiness. Does
Mhm.
it does it have a big impact if you have a head injury in a different hormonal status based on your menstrual cycle?
Yeah, it actually, that's a great point that you raised, and it's a huge difference. So, in menstruating women, if you sustain a concussion in the luteal phase, so like right before when you're going to get your period, there's a greater chance that you will have persistent symptoms or like a complicated recovery.
So
But also,
just because I don't know very well, the luteal phase,
oh,
that's
yes,
like leading up to
like
day one. So that'd be like if
yes,
you had
exactly.
PMS, that would
Like,
be that
yes, exactly.
phase.
Like
Okay.
I want to say the 5 to 7 days before day one. And that phase, yes, you're at increased chance of even getting a concussion. And if you get a concussion, you're more likely to have um, like persistent symptoms of concussion. And then the other thing is, yes, it gets complicated for women in perimenopause because they're not sleeping. Is it the concussion? Is it perimenopause? Moody? Is it the concussion? Is it perimenopause? So that is one reason why I love, like, it's a team effort always. And I love to loop in like naturopathic doctors for that holistic lens and also looking at optimization versus pathology. So that, like, the doctors are great for pathology, but concussion is very much optimization, as
Mm.
is living through perimenopause. Um, then the other thing about the luteal phase, since you're at an increased risk of concussion during that phase, then this is like super key for you. Returning an athlete to play, you wouldn't want to throw them back in during the luteal phase.
Interesting.
Because- Right? Like that's another, there are only a couple of things we can do for concussion prevention, and that's one like
Mm.
totally can do.
What is it
Uh,
about the luteal phase that makes it so much more risky?
yes, if I'm not mistaken, the theory is has to do with the progesterone.
Mm.
And now is it the progesterone goes down? I should know
I
this,
always forget this.
right?
I always forget what the hormones do in the different phases.
Yes,
Is
but
there is there a hormone that's more neuroprotective?
oh, that is the progesterone. Or actually, I guess
Progesterone.
both of them.
Yeah.
But I know this specifically has to do with the progesterone because they started clinical trials trying to use progesterone during, like after an injury for recovery, and it didn't work.
Oh.
So that's the reason why I know it has to do with progesterone. And
Mm.
interestingly, they've looked at women taking birth control because you would think, okay, well, maybe that would be protective against concussion, and there doesn't seem to be a correlation, which just shows you just how complex our bodies are. Like we try and
Mm.
manipulate them, but they say no. You
Yeah,
won't be
interesting.
manipulated by your medications.
Yeah, interesting. So something about the level of progesterone, it makes it more likely to have that
Vulnerable.
inflammation, that metabolic cascade. Is that what it is, you think?
Yes. So that's
And it's okay if you
interesting.
don't know the answer. I'm just
No,
curious
I don't
about
know,
what
but
are the hormones doing that are protecting us or making us more susceptible. And I guess it
I'm
just
gonna
makes
look
it
it
that
up.
adds to the
We
idea
are
that
inflamed during that phase, though, right? We are more inflamed and will be retaining more water.
mm,
So that would make sense that we would be more vulnerable, even to other sorts of injury, which
right.
I think there is research, right? You tell me on the phases and like ACL injury.
Right. I mean, I'm not the best person to ask about what the research says because I barely read research, but it just made me think about how you mentioned earlier that doing whatever you can proactively just to be in a healthy state going in, and if your hormones are all over the place due to lifestyle or whatever, if you're going through
Mhm.
perimenopause, I guess we just want to again be doing whatever we can to create a good state of general health, homeostasis in the body, knowing that in that luteal phase it is going to be a little bit more susceptible. If, I mean, we could be. Would you say that someone who has more, I don't know if you have the answer to this, but someone who does have more wildly fluctuating hormones and has more symptoms of PMS, would that be more at risk of having a more severe? Like, is that an indicator of general risk to concussion?
Concussion? I
Yeah.
don't know the answer to that, but I do know that what you just described, if that person sustains a concussion, or regardless, a concussion is the great amplifier. So if they already have troubling PMS, it's going to be even worse with a concussion. If you have
Right.
mild PMS, then it'll probably be bad when you have a concussion. And I
Right.
think it's that just the body is working so hard to restore homeostasis.
Yeah. And like, what
Some people
about,
will even miss their periods because of the, um, like after concussion, there can be a disruption in the hormone circulation. So
mm,
some women will miss their period for a month or two, or some will get an extra period. But with trauma, like any sort of trauma, the same thing can happen. So it's like, is it the concussion? Is it the trauma?
mm. Yeah, hard to tease out sometimes.
Mhm.
Would this make women more susceptible to more severe head injuries?
There, yes, so the research is mixed. It used to be that women are more at risk for concussion and more persistent symptoms of concussion, but then there's been more research that has taken into account other things. For example, are they also a migraine sufferer? Do
Mm,
they have XYZ health conditions? And with that, sex is not necessarily the determining factor.
mm,
So it's really interesting, just like
mm.
the different lens, and maybe we think it's one thing, like black and white, and then actually no, it's
It's not.
many shades of gray.
Surprise, surprise.
Yes, surprise. How do you, and maybe you don't, but um, how do you think or observe the hormones affecting your work with people?
To be honest, I don't ask about it a lot. And
Mhm.
maybe I should because I keep hearing that it does have an impact on how women feel different phases in their cycle. They might have more energy or less energy. And maybe this would have been something that I was more interested in when I was doing more personal training. And then you could see a definite change in their energy level. And but now you know what? Shame on me. I barely think to ask about it. You know, like what phase were you in when
Mhm.
you had this injury? And it'd be interesting to track if people have different outcomes in their healing if they were injured in one, if, for example, the luteal phase, if people are more
Yes.
susceptible to maybe the tissues are less resilient in that phase in
Mhm.
general. I'm not sure. That's something interesting
Yes.
to keep track of, actually.
You should start asking. I bet you'll start to see some trends.
Do you think people have an accurate, like, do they actually know? Like, would people
I
know
think
what phase they're in?
now a lot of people use the apps
Right,
to track. But they would know, I think, if they were just before their period.
right.
So even if they didn't know luteal phase, they might say, oh, yeah, I know I was just about to get my period.
Yeah.
But so many people, when I ask them, they just pull out their phone, like they're tracking it.
Wow. Yeah, that's
Yes.
amazing. I'm gonna have to start asking people about that, especially
Yeah,
if it's
that,
a someone whose recovery is not typical, if they're taking longer
yes.
to heal and they seem to be doing everything that they should be doing to get better. They're doing their exercise, they're not doing the thing that hurts them, they're sleeping well, and they're still
Yeah.
struggling. We also know, well, we don't know with research, but there's a lot of experiential evidence that the state that you're in emotionally has an impact on the recovery of any injury. It can create it maybe a bit more of a tense state that your body is in when you become injured, and that can make it a bit more challenging to get through. And I wonder if for concussions as well, if you're in a some kind of a conflict with a partner and you're a little bit more sympathetically aroused and more tense in your
Absolutely.
body, could that also have an impact? And does that need to be addressed as part of the recovery process too?
Yeah, similar to you. I don't think there's research, but what we observe, I think it definitely makes a difference,
Yeah.
right? If someone's going through a divorce or just having a stressful period in their life. Like I'm always asking about that
Mhm.
because yes, the state of the nervous system when they get injured and like were they already just running low on the oil,
Yeah.
right? Maybe that was impacting their sleep. So I definitely think if someone's going through a super, even like professional hockey players, if they had a argument with their partner that morning and thinking about they're about to sell their house and then their body is jostled, right?
Yeah.
It's different than I'm good, right? Everything is good.
Yeah.
So
Oh,
it's like
yeah.
there's a limit to our ability to withstand trauma,
Mm.
I guess.
Hmm. Just to switch gears, because I have a few more questions that I wrote down that I definitely wanted to make sure I asked you. Um, the whole eye movement thing, I mentioned before that you had this cool piece of equipment, like it was a whole head mask set up that could measure eye movement. And I've become quite interested in eye movement because it is something that shows up with mechanical restrictions because of how the eyes and the spine develop together. That when our eyes, as developing small people, when our eyes move, our spine learns to move in that same direction, and over time we develop spine mobility and function. So the eyes do have quite a large role to play in movement, but they also are literally a chunk of your brain that are on the
Mhm.
outside of your body. So it makes sense that they would be affected by brain injury. So, what do you look for with eye movement, and what can that tell you about their state, and how do you work with that for recovery?
Yes, so I use the like eye trackers to get objective data on how the eyes are moving because the eyes are the brain, but also not everyone has those eye trackers, so you can observe them just using a pencil, let's say.
Mhm.
We know that certain eye movements bias certain parts of the brain. So there's this jump eye movements, like when we're reading, those are very much frontal lobe.
Mm.
So when I'm looking at the eyes, I'm thinking, okay, what part of the brain do those eye movements bias? And what else is coming up that is pointing towards that part of the brain not being optimal? Again, we're not saying
Mm.
like pathology, brain bleed, CTE. It's just
Mhm.
like, okay, this is a pattern I'm noticing, and I want to bring the health back to the system. And then smooth eye movements are more parietal lobe, which is more position sense. So maybe looking at patterns there. So I'm looking at, are the eye movements accurate? Are they effortful? Then looking at pupils. There's one reason why we're so sensitive to light after concussion is the pupil response is not ideal, which is like that's controlled by our nervous system. So paying attention to how the pupils are responding. I feel like that's it in a nutshell.
So you said that
What do you look for?
smooth eye
Yes.
movements are related to the parietal lobe, and
Yes.
are there other types of eye movements that can give you an indicator about specific brain areas? What are
Yes.
some
So
other examples of that?
the jump eye movements, like from the, like if you're reading
Hmm.
or just looking back and forth, essentially, those are more frontal lobe.
Mm.
Those are called saccades. And then the other one is called a pursuit, smooth pursuit.
Yeah.
Then there are anti-saccades. So that is when, let's say, um, there's something on my right that I don't want to look at. And so I intentionally look to the left. I've
Mm.
used that inhibition and I've purposely done something to the other side. That's frontal lobe. That's
Mm.
actually a really good test of our frontal lobe health. And
Mm.
then we have different reflexes, like the vestibular ocular reflex. When our head moves one way, our eyes should move the other. So there are a lot of different ways to examine the eye movements and how they're working with, like you're saying, the spine, and figuring out what isn't working so great, how that might be driving symptoms. Like if those jump eye movements are looking very effortful, not accurate, then definitely reading is going to be challenging for them. Or
Mm.
we do like 100,000 saccades a day, or like those jump eye movements. So
Yeah.
if they're not efficient, they're effortful, you're going to feel tired and crappy.
Yeah, interesting.
So
So your eye tracker tech can tell you really specifically where the deficits are there. And then how do you choose who you want to do specific eye retraining with? I'm assuming that's part of the rehab
Mhm.
process for some people.
Yes, absolutely. So I would say most people need at least a little bit of it just because the eyes are the brain. So there's a
Mhm.
good chance they're going to be disrupted. And then looking at, okay, which movement specifically is disrupted and working on getting that back to normal
Mm.
range. So with the eye tracker, we can tell exactly like, okay, the reaction time on this eye movement is out of normal range. So that's
Mm.
really nice when I can compare it to a norm. But when you're working, just like you, when you're working with something over and over again, you can also just see it with your eyes that that is not looking as good as I would like it to look.
Mm. Well, this makes me think of again the topic of subconcussive symptoms. And do you have anything that people can use where they can measure maybe how well their reaction time is, how well their eyes are moving? That could give them a glimpse into, well, maybe I've never had a concussion, but according to this data, I'm not really doing so well with my eye movements. So maybe they can use that as a way just to get an insight into how healthy their brain is and how resilient it is, and if they need to do something about that. Is that a thing?
Yes. So I will give two ways. One is it's called the vestibular ocular motor screen. And honestly, people can YouTube it. And it is 5 different movements that the screen will bring the person through. And if those are not feeling good, like just with this as keeping it in mind. If those are not feeling too great, it means that things are not optimal because we should be able to do all 5 things in that test, which is do jump eye movements, do smooth eye movements, turn your head and keep your eyes on something.
Mm.
So that is very low cost to entry. Then I have my app that I made, the Brain Toolkit. And in that, there is a test for reaction time. There is a test for the eye movements, different types. And also one that I didn't mention, our optokinetic reflex, which is essentially when a train passes by, our eyes know to look, reset, look, reset. So all of these things that we take for granted that we're doing all day long, and then they start to become compromised.
Mm. Something it made me think of, I remember learning about this, but I can't remember. The vestibular ocular reflex, is that where your eyeballs need to stay still, but your head can move with your
Exactly.
eyeballs staying in one centered position? So that's a
Yes,
hugely important part of how we walk down the street with our bodies
exactly.
functioning correctly. We need to, with every footstep, something that we teach and study in anatomy and motion is how the body moves with feet on the ground and eyes level on the horizon. And if that
Yes.
reflex isn't functioning well, then good luck keeping your eyes level and actually moving your body without getting dizzy or seeing everything sideways. So you could imagine how people's
Absolutely.
movement patterns might shift and feel really uncomfortable in their body if their vestibular ocular reflex is affected at all. And what part, is there a part of the brain or a specific type of head injury that would disrupt that would make you want to work with that
So
vestibular
I wouldn't
ocular?
say it's a specific type of head injury, but that reflex is the connection, well, between the eyes and the inner ear.
Mm.
And well, and the neck, essentially, because our eyes are connected to our neck through those little muscles, our suboccipitals at the
Mm.
top of our neck. So there's a good chance there might be at least a little bit of a disruption in this reflex. And
Mm.
like you're saying, it's always on when we're walking, but not just left and right, also up and down.
Mm.
And if you have a disruption, you might start to protect yourself and then
Mm.
lose the head movement to one side. And it's like having a little piece of sand that is just growing and
Mm.
growing and growing. And that's why we need a
Yeah.
clinician really to look
Holistic
on the outside.
attention.
Yeah. But I would say you could probably try and test it yourself, but our body will try and trick us and make us think that we're functioning fine. So
Mm.
the objective observer can definitely be key in that case.
Yeah, yeah.
And I guess you don't look at that reflex in your practice?
Not directly, but
Right.
if you look at, someone's alignment and they have a head that's very off center, like we said before, maybe very forward or maybe tilted to one side. I've had the experience before of working with someone to restore movement in their neck to get it more centered again on top of their body, and they feel dizzy afterwards. Like it takes a little bit of time for the new position of their head and their eyes to communicate together again. And I'm guessing that is a sign of some vestibular adaptation needing to
Imbalance,
take
yeah. So
place.
they've adapted to the
Yeah.
new position, which is not the optimal position, and then you get them into the optimal position in their system.
And their eyes are like, where
Like,
are we
what is,
now?
yeah, what is going on?
Yeah. Which is
Exactly.
pretty quick
So,
to recover if as long as there's no problems with their nervous system being able to adapt to that. But it is quite an interesting stepping off the table or
phenomenon.
after doing a movement and being like, whoa, I feel completely off center and kind of dizzy now. But always
But I'm
encourage
actually
them.
better.
Yeah, it's actually not a bad change. Don't worry, your body will get used to it. Just walk around a bit, you'll feel better. But yeah, only indirectly really do I do anything with that. Although I have worked with folks in the past on if they have a definite deficit in their visual field, like their eyes
Mhm.
can only go one way and can't cross midline to go to the other side, almost for sure that's going to be affecting their ability to rotate their spine or their neck left and right, which can have a huge impact on how they're walking, how their joints are moving in a balanced way. And that becomes quite an interesting part of changing the way someone's body is moving just by working with their ability to track their eyes right and left, which could be a result of an old concussion or subconcussive events that have never been addressed. So it really is so holistic how this stuff works together, eh?
Yeah, and it's interesting because like what you're describing is essentially rehabbing the brain,
Mm.
right? From just like the other side.
Yeah, 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 yeah.
Because you're working on the cerebellum, the movement coordination center, body maps in the brain are going to adapt as you're increasing movement. You're definitely changing that visual field you were
Mm.
saying. So yeah, it's very cool. Oh yeah, so you can see the Neuronito behind me.
Yep.
And so the artist who makes that, I had sent him a message and said, "Oh, I work with the brain and concussion." And he said, "There are many ways that we can work with the brain." And I think
Mm.
that's what you just said makes me think of. It's like,
Mm.
yeah, we
Through the body, through
true.
moving.
Yeah,
Yeah. Well, you need your brain for everything. So
yes. Right.
everything can be brain training, but getting
Right.
specific about what your brain actually needs based on the
Mhm.
symptoms that you're having. Which
Yes.
reminds me that I read something on, I think it was a little educational Instagram post that there are 7 phenotypes or
Oh,
different
yes.
types of concussions. Do you want to briefly describe these different presentations that concussion can show up as?
Yeah, so it helps when we're assessing to sort of organize where the symptoms might be coming from. And so we've been talking about the neck. So one of them is cervicogenic, which means whatever that lived experience is, some of it's coming from the injury to the neck. And then there's ocular, motor, vestibular. Sometimes they're considered separate, sometimes together, but essentially the disruptions in eye movements or in that balance center. How's that doing? There's cardiovascular, which is that aerobic exercise tolerance we usually
Mm.
think about. Then there is sleep. Are we sleeping or is there a huge disruption in that? There's a mood one. So, how is mental health affected? How many did I mention? What am I missing? Mood, sleep, eye movements, vestibular, cervicogenic, aerobic. What's the other one? There's another one too. I think inflammatory. That might not be one, but that's what I think about is like, how is that? Or did I say metabolic?
No.
No, I didn't, right? Okay, that's the one. So, like we were talking about fuel, the quality of the fuel, like how much inflammation was already in the system,
Mm.
and can that be driving the recovery or the
Mm.
non-recovery?
Hmm.
And again, it goes to that holistic approach.
Mm.
It's
So
taking
someone might
care of them.
have a
All of them.
all of them, or
Yes.
primarily relate to one of those types.
Yes.
Yeah.
And then that can also guide care because if it's mostly coming from the neck, maybe you would see one practitioner. But if you have something's coming from the neck and maybe the sleep stuff is really challenging, and then you have the metabolic, then there'll be a different team that
Yeah.
is approaching it.
Yeah.
Sleep
Is
is such a key thing, I will say, like for life, but
Well, during sleep, I wanted to ask you about this actually, is we have something called the glymphatic system that is important during sleep for it's kind of like cleaning out the brain. The cerebral spinal fluid flushes out toxic stuff from the brain
Mhm.
into the bloodstream to be eliminated. And is that one of the reasons why for concussion sleep is so important? I mean, you're also resting, so it's energetically you're getting a little break, but what is so good about sleep for recovery?
Yeah, I would say you're bang on with both of those because the glymphatic system is like the little janitors in the brain that they come at night. And we talked about that metabolic cascade, which is essentially an inflammatory process. So we really need that sleep so that the glymphatic system can do its work. The other piece that ties into this is the neck, though,
Mm,
because if the neck is a disaster, then it is going to, let's say, impair or it can affect just that cerebral spinal fluid flow. And
right.
so this mobility work that we're doing can tie into concussion recovery in that way.
Mm, okay. So make sure that you
Super
are
interesting.
keeping on top of your neck mobility and potentially getting a little bit of treatment if needed
Yes.
for craniosacral or for any neck restrictions. So you're an
And
osteopath, so you do a bit of work in sessions with people if they need it?
yes, for sure. It's
Amazing.
the manual therapy. And so I don't know if it's the same in Australia. Osteopaths are funny because in different countries
Yeah.
it means
Different.
different things, but soft tissue work for sure, and in
Mhm.
a holistic way because everything is connected, but definitely a lot of neck work, cranial, and ribs for sure
Mm.
can play a big role, and just normalizing the tissue. So similar to the work you do. I don't want to say similar, but with the same goal,
Mm.
maybe.
And just a couple more things before I want to ask about your PhD research. So don't
Oh
let
yeah, oh my
me
gosh,
say
there's so much to
goodbye
talk
before
about.
I ask you about that. But I'm just curious, is there anything that, I mean, I've witnessed your practice for the past 10 years. You've been really involved with
Crazy.
concussion rehab, but is there anything in those 10 years that you've really changed your mind about or that you do
Oh,
differently?
great question. Oh, I certainly hope so. But what is it on the top of my head? Hmm, I can't pinpoint it. Like for sure, there must be things that I've changed, I would hope. I've always taken a very team approach, so I don't
Mm.
think it's that. Oh my gosh, I'll have to get back to you on that one.
That's okay. You can sit with
Yeah,
that one for a bit.
yes, I will sit with it.
While you're sitting with it, could you tell
Yes.
me, Melissa, about what is the topic of your recent PhD? And congratulations on that again.
Thank you. So that actually was on eye movements after concussion.
Ah,
So
cool.
literally what we were talking about, and it was assessing them and then providing an intervention in virtual reality though. And I
Mm,
used the NeuroFlex goggles, and right now they are in Australia.
mm.
And that is actually a big, what would you call it? Like place for them. They're getting into working with the footy, what would you call it?
Yeah,
Groups
footy. Yeah, teams.
to do baseline testing.
Oh,
So here's
cool.
the thing is someone can come in, but I don't know their baseline. So baseline testing can just be hugely important to see, okay, for one, we do want to get you back to the most optimal state, but how far are you from where you were is also helpful to know.
Mm,
So yeah, so I used that technology. So that was super fun
mm.
um, for my project.
Yeah,
So,
cool. What did you learn about that?
so we did how my study worked is we had a group that just got usual care, which really is more like advice on how to manage your eye movement symptoms and pacing, easing back into visually stimulating activities. And then there was the other group that got 6 weeks of eye movement training in the virtual reality. And
Mm.
that is interesting in and of itself because virtual reality is so stimulating.
Yeah.
Like, have you been in virtual reality? Do you tolerate it
No,
well?
I'm scared. It sounds
This,
overstimulating.
right, yes. And some people, like, even without a concussion, you go in and you get disoriented. So
Yeah.
we weren't sure how people would tolerate it. And then we did exactly how I described what you would do. And what I do in practice is week by week, we progressively advanced the activities and personalized them because everyone was a little bit different. I can't tell you the results because it's not published, but you can look out for them. But that was good, but very long.
So was it a positive result that you got? It's exciting stuff that you think can be
Yes,
used as part of people's recovery in the future?
yes,
Oh, that's
absolutely.
cool. So the conclusion, although not really conclusion because we can't say what it is, but
Right.
that VR is a positive tool.
Yes.
That's cool.
And I would say when used titrated, like in a titrated way. So you can't just
Right.
go do 30 minutes of VR.
Yeah,
Like, using the green, yellow, red is going to be important for that too. And I tell
right.
people the green, yellow, red, it applies to everything,
Yeah.
like just
Just
being
life
self-aware. Yeah,
generally.
it does, right? So if only we used that, I bet we
Yeah.
we would be, cruising.
Yeah.
What guideline? So let's say you're working with someone
Mhm.
and you're working on an injury.
Yeah.
Do you have anything similar that you would use
Yeah.
when?
I was actually having a conversation with a client about this yesterday, and I really struggled to word it in an efficient way. But essentially, her state was she was just a bit out of balance with her pelvis and hips. She was a bit asymmetrical, and she felt better after seeing me, but then she'd go and do a Pilates class that was like a hard one, so maybe verging into the red of that
Okay,
scale.
yes.
And she said that after that, she felt her symptoms come back. And what I was attempting to express to her is that when we are under any kind of strain that's higher threshold than maybe we can tolerate with efficient movement mechanics, then we'll resort back to our path of least resistance. So we won't use a newer, more quote unquote efficient movement pattern to do something really, really hard. We'll go to the level that is just easiest for us to do, even if it's a worse way of moving, but it's more familiar and we're stronger in that pattern. So we'll use that pattern, even if it ends up being, detrimental because it puts us back into a shit alignment afterwards. So I told her that this is often what happens. So we need to have a way of you being aware of what that feels like when you're going into those not as efficient older patterns. And it's not always easy to tell because she wouldn't have symptoms during the Pilates class, but she'd have
Right.
symptoms the next day. She'd feel really sore. So it wasn't anything in the class that told her symptom wise that she was doing something inappropriate. So I think what's really valuable is to have, like you said about having a baseline, to know ways of checking in with yourself that tell you in a sensation way whether something you're doing is moving you into a good or a worse direction. And for me, what's always been helpful, and this might not be for everyone, but if you have a way of checking in with how well you're breathing while you're doing physical
Okay.
activity. So if you're doing something that's really challenging strength wise, and you find yourself you can only hold your breath. You can't breathe with your diaphragm. Do a nice 360-degree expansion. If you find yourself resorting into that, and then you notice, oh, I'm not breathing, and then you try to breathe and do that same exertion, and you no longer feel as strong, then probably that's too intense for you, and you should only do the amount of strength you can produce breathing in an effective way. And she said, oh, I have no idea how I'm breathing, so that's not going to be a good baseline for her to track. But if you did have a baseline of what it feels like to breathe at rest and can you maintain that good pattern with higher and higher exertion, then that might be useful to pay attention to. So I think everyone's a little bit different what you want to pay attention to. Like maybe you do a movement and you don't feel the same muscles firing on one side as the other. That might be good to pay attention
Yeah.
to if you're in a balanced state, like you've just had a treatment and you feel really even and you do something like, I don't know, a very simple single leg bridge and both legs feel pretty similar. But then you do something really, really challenging and you go and test your single leg bridge and now you feel like you can feel your muscles on one side and the other side you don't feel the same kind of muscular activation, then maybe that's an indicator for you that you've pushed at a higher intensity than you should. So I think what you said about baselines, it's really good to have something that you can check in with your own body that tells you whether you've pushed the threshold a little bit, and hopefully it's not pain, because we don't want you to get
Yes.
to the point where you're just
Right?
pushing to the point of pain. We want to have something that you can tell before you get to that state. So I don't know if any of that
I really
resonated
like
with
that
you.
breathing. The breathing, it wasn't an analogy because it was real, but the breathing explanation that you gave, I
Mm.
really like that. I feel I can try and implement that.
Give it a go. But it's only useful if you actually have a
Know
practice of
how
being
you breathe.
aware of your
Yes.
breathing. But it's really valuable for everyone to learn what it feels like to use a good diaphragmatic breath because it will help you have more uh, well-being with your pelvic floor, with core strength, with alignment, with all of that. Like it's just a good idea to be aware of what it feels like to actually breathe with your diaphragm if you've never done it before. So um,
Yeah, and I think so many people have suboptimal breathing mechanics. I know
yeah,
mine are like not great.
yeah.
And I have to
And after
consciously be like, wait a
concussion,
minute, what is
I
going
I would
on?
imagine that after a concussion, it gets a bit dysregulated as well, due to not only the head position's going to be off, but the nerve supply to the diaphragm might be compromised, and yeah, that could be something to track as a measure
I
of
did
how your
have
progress is.
or often I will have people on the O2 monitor, just like the
Mm,
thumb one, to see how their oxygen levels are. And
right.
some people are just doing these shallow breaths and the O2 will go down. And I had one patient once who said, "Oh, I don't think that could be impacting my symptoms."
Mm.
I'm like, I'm pretty sure it can be.
Trust me,
So you
I'm a
do need
professional.
oxygen.
Yeah, yeah, that's funny.
So, and now, honestly, I think most phones you can just use free apps to monitor your O2.
Mm.
So that's like a little check-in we can do.
Yeah. Yeah, I think it's so important to have things that we just are aware about ourselves that tell us we're doing good. And
Yes,
just to be able to notice is quite valuable. And um, maybe that speaks to the outcome for recovery as well. If you go into having any kind of accident and you're already quite aware of yourself and aware of what is a good baseline, it'll be a smoother recovery process. So it just goes back to what you said at the very beginning of our chat about coming into a concussion or any injury in a more healthy state, which includes just awareness of how you are.
yeah, absolutely. It sets you up for more success
Uh-huh.
or like faster success, let's say.
Is there anything else before we wrap up that you think we haven't talked about, but you'd like people to know either about what you do specifically or concussions in general?
I would say that nothing too much except don't try and recover on your own.
Right?
I think people, especially there are so many resources out there, and that is amazing, but you're not the same as your teammate, as your
Mm.
classmate, right? Just like you're coming to this world with different strengths and weaknesses. And so I would say recover with a clinician,
Yeah.
and I think that usually will get the best outcomes.
Yeah. And I mean, if you've just had a head injury and your brain is compromised, that's not really a good place to try to figure out something new
Yes,
from.
absolutely.
So,
Actually, do you know Ryan Holiday? He's like the
yes.
right? Okay, so I just listened to an interview with him, and he was saying how important reading books is.
Mm.
And also, there are a lot of books out there that are written by people who've done the thing thousands of times and figured it out so that you don't need to struggle.
Yeah.
And I think like the work you do, the work I do, it's similar. Like I've seen thousands of concussions. So it's going to be
Mm.
way more efficient,
Yeah.
just right,
Yeah.
than you trying to work through it. And that really stuck with me. And I've
Yeah.
started reading even more since I listened to that podcast.
Yeah, I remember him saying that as well. Yeah, and I listened to that and I was like, "Oh, I don't resonate with that. I need to be the one making the mistake to
Oh,
learn from it. I don't want someone else to
okay.
make the
Yes.
mistake and then me learn from that. That's no fun. I need to like get in there and get dirty, which is maybe not a sign of health for my part, but that's just how I'm wired.
It's
A bit of a glitch in my making.
or it's like specific. I want to say not condition specific, but like scenario specific.
Yeah, I'm pretty sure that if I had a concussion, well, actually, I shouldn't say I'm pretty sure. There's a very miswired part of me that needs to do everything myself,
Mhm.
and
Yes.
sometimes that becomes quite toxic. What do they call that? Toxic independence.
Okay. Yeah.
I
Like
think
you need to control everything,
I need to
right?
be able to figure it out myself, otherwise, I am not a good person. There's definitely a little bit of that running in my background, which can be highly motivating, but also,
I work
it's
with
okay
a
to
lot of
ask for help.
that.
So, what you say is good for me to hear. If I ever have an acute concussion, I will try to remember that I should
Like I
not
said,
DIY my recovery. I should reach out to someone that I trust, like yourself. So if anyone
yes.
if anyone does want to reach out to receive
Yes.
support, where is a good place to find you, Melissa?
I would say the best place is Instagram because I'm there the most. There are also a lot of freebies on there. If anyone
Mm,
goes now, cheat sheets, information, and that is my handle is concussionrehab.ca. So that's pretty easy to remember.
yeah. So people can find your website there and contact
Yes,
information, and you also have a lot of good educational content on your Instagram
resource.
page. And your app is called Brain Toolkit. And
Brain
is that
Toolkit.
something that anyone can download and start to look at?
Yes, so it is, especially if you're in sports, I think it's great. It can be
Mm,
used for other things for sure, but it has eye movement tests. You can use it for exercises, reaction, balance, and it gives you a little map of your balance. So it's super fun. And there is a cost to it. I don't know what it would be in Australian dollars, but it's pretty cheap. It's the price of two coffees or something
mm,
like that. It's a one-time payment. So if you're really into the brain and active,
yeah.
might be good
Cool.
for you.
And that's something where people can look at these eye movement assessments and just
Yes.
get a sense of
And
baselines and
exactly.
exercises.
There are little like explanations and also tutorials. So they can like nerd out, test themselves. It even gives where to start in terms of exercises. So if they notice something is like a little bit off,
Mm,
gives them some tips and then they can retest themselves.
cool.
So
So,
it's a good little resource.
yeah, the things that I took away from this conversation are be healthy.
Yes. Right?
Set yourself up by just being as proactively healthy as you can, which includes sleeping well, eating well to reduce any excessive amount of inflammation in the brain going into it. The importance of your neck,
Yes.
alignment and strength and mobility and whole spine mobility. Um, we can all do a little bit of proactive work on that, not just people that think they have bad posture, but yeah, make sure your neck is moving well. Work with
Yes,
someone if you're not sure what
absolutely.
that means. And the part about hormonal status and the luteal phase, that's quite interesting to me. I hope that I'll remember to start asking some of my clients about if they're having trouble recovering from injuries, ask about their time in their cycle that they sustained it and if that has any kind of impact.
I'd be interested to know
Yeah.
what you find.
Yeah, I'm gonna have to write a little note for myself to start asking my female clients. All right, Melissa. Well, this was so much fun to chat, and
Yes.
I feel a little
Yes.
bit more confident now that if I had someone that I knew had a concussion, I'd know what to tell them to do. So seek a diagnosis from a doctor, but it's very subjective. So maybe you need multiple opinions, and then don't be afraid to ask for help. In fact, you should not DIY your therapy,
Yes.
and it should be holistic. It should not just be an isolated type of approach where people are looking at one thing and not you as a being. And we know it's not the same for everyone. Everyone is so different, so we need some individualized care.
And I think, so I just want to add one thing, and
Yeah,
that is, um, remember how I said doctors, they prescribe and refer, that is their role. So I
right.
just want to point out to people, if they go see a doctor, there is no medication for concussion recovery, but they might be prescribed a medication. That
Mm,
doesn't mean they don't need rehab.
right. Should they take
So,
a medication?
I guess that they would have to decide on their own, but
Right.
what the medication usually is an antidepressant,
Okay.
um, or an antidepressant that they're being prescribed for their headaches.
Right.
So what I usually tell people is if you're prescribed a medication and you decide that you want to take it, it's right for you, always ask the doctor what the exit plan is, because you need to know how you're going to come
Mm,
off that medication one day.
right.
And you should know if it's going to be drawn out, if you can just stop cold turkey, because I think the other end of it is not often thought about, but it's like super important.
Mm. Yeah, for sure. And I remember the start of our conversation, you mentioned that you were taking some medication that started a whole series of events
Yes.
that led you to be concerned about your brain health.
My brain.
Yeah.
Yes. That's funny how things
Yeah.
evolve.
Yeah. Cool. Well, thank you again, Melissa, and
Thank you so much
we'll
for
have
having
to
me,
watch
Lisa.
out for your PhD when it's actually
Published.
published so we can learn about what you discovered about VR. All
Amazing.
right.
I will share it.
Thanks.